Hello, and welcome again for another episode. Today we're going to be talking about patient responsibilities. I know the last time we talked it was a little dry speaking about patient rights, but it is an important topic. Today I'm hoping that we'll be able to talk a little bit more freely, and we're talking about patient responsibilities. Now, it might not seem important when you're going into the hospital, but we do have responsibilities as being a patient. And we're going to color some things in with some stories that I've had gathered over the past decade of practice. So, one of the main things that we all have a responsibility in doing when we're a patient is definitely giving accurate and complete information. What's wrong with you? What's going on? Now, I know that you may have already talked to a nurse or a medical assistant, and you might have been asked questions about why you're there. But when the doctor comes in, many times I do hear, well, I already told your nurse. Don't you know what's going on with me? And it's not that we don't know, it's actually the fact is we want to hear it from you because then we can actually answer questions that you may have, but also ask relevant questions ourselves to figure out more about the issue that you're having. Take, for example, that you come in with chest pain. Well, I've had many times that patients tell my nurse or assistant about the chest pain, but I'm going to ask a few more questions about the type of pain that you're having, where the pain is actually occurring. Does the pain move? Does the pain happen when you're walking or running? Does the pain happen at rest? All these things give me a better idea of what's going on with you. So it's really important that you help us with creating a narrative about what's going on. Other questions that we're going to ask is about your past illnesses. What things do you currently are undergoing treatment for? What kind of things are you not going treatment for or have been cured? Now, this is going to really help us because if you had experienced similar symptoms or a disease before, or maybe you went under a treatment for something. Many times I have patients coming in and what they forgot to tell me is that they had cancer and they completed a course of chemotherapy for that cancer. Well, that's really important because if you had chemotherapy, we know that certain chemotherapeutic agents do cause side effects. So knowing that information is going to give me a better idea about what you could be dealing with. Now, medical history can be quite long, and we may not remember everything. So it is really important as we age, and even for our parents' sake, that we keep a list of medical issues and our medications. I usually have patients, usually older, who keep something in their billfold that tells us what medications they're having and also what kind of diseases have they been dealing with. And along with that, surgeries as well. All of those things are very helpful. So talking about past things that have happened to us, don't forget the surgeries that you've had. Knowing that something was removed from your body is pretty important, especially if I'm trying to figure out why you came in there with abdominal pain. I've had many times a patient who forgot that they had their gallbladder removed, and I'm thinking that they're coming in here with abdominal pain, and I'm thinking, well, could this be related to the gallbladder? Well, lo and behold, sometimes I get a CT scan and realize that you don't have a gallbladder. Things like that are pretty important, because then I wouldn't be barking up a wrong tree. Another subject which definitely comes up is social issues. So knowing more about your social life is really important for us when we're trying to figure out what may have led to the reason why you're coming in or what may complicate things. So knowing if you smoke, use alcohol, vapes, or even drugs will help us determine whether the medications that we're going to give you are going to cause adverse reactions, or if a drug won't work on you, or it could be something that we want to counsel you on so that way you realize the effect of what you're using has on your body. Sexual orientation is also asked as well. As we know, certain diseases are more common based on sexual practices. Knowing if you have firearms, and that is a new one for us as physicians, because we do know that there is a increase in prevalence of patients who have firearms and have them in the household. And we also know that there have been a lot of mass shootings and suicides and gun injuries as well. So telling us whether you have firearms or not and answering us truthfully will let us know what kind of risk you and your family have and how we can go about counseling you to figure out how you can keep those firearms safe. Now, I do understand that a lot of this is personal information, but don't forget that you do have a confidential relationship, and the information that you give to us does not get revealed to anybody else. We want to know truthfully about your life so that way we can treat and tailor the treatment to you. When we talk about medications, we usually talk a lot about prescribed medications, but what we usually forget is over-the-counter medications or any kind of nutritional supplements that you take. So these are pretty important because nutritional substances such as St. John's wort or echinacea or elderberry can sometimes affect how our drugs are going to interact with them. And it's really important to let us know whether you've had any of those supplements and anything else that you're taking over the counter, or even if you're taking prescribed drugs from someplace else which have not been prescribed to you. So many times I've had people tell me that they're using oxycodone or trazodone to help them sleep, but they weren't prescribed to them and they were using somebody else's supply. And that can significantly impact what I'm going to give you. And the last thing I want to do is cause some kind of reaction or not even notice that you're taking a drug for a while. And I could even cause withdrawal in you because I wasn't aware. So it's really important that you tell us that. Speaking of withdrawal, I think one of the key things that we can't forget is if you use tobacco or nicotine products. I think a lot of issues have arisen from people not telling us that they smoke or they use nicotine, and they usually start to get withdrawal from that. And that can make somebody pretty anxious or even agitated at times. So letting us know that you use any medication or drug on a regular basis can help us make sure that you don't have withdrawals as well, or even be ready for the withdrawal from those. Make sure that if you or your family have an advance directive, that you do provide that or let us know about that. Sometimes these are called living wills. Sometimes you might have a DNR order. And it's really important that you let us know or even have somebody bring that in to us so that way we can have that on documentation. The last thing we want to do is supersede somebody's rights or their own wishes with regards to how they want treatment done. And it's really important that we have that information ahead of time. And then lastly, and most importantly, is let us know if you have a health plan, because knowing that is going to help us not only with billing and the financial things, but also our case managers and social workers know what kind of benefits you do have. Sometimes our health plans have additional benefits and support systems in place to make sure that you get the care when you're out of the hospital or out of our treatment facilities. You may or may not be aware of the additional benefits that your health plan has, but definitely case managers and social workers can dig into those and help you understand what are the additional benefits that you might be getting. For example, sometimes some of our elderly patients have additional support at home and can have visiting doctors or visiting nurses. Or if you have a chronic disease, there might be plans for you to keep that chronic disease at bay and have actual people, such as nurses or doctors, which will keep an eye on you from afar. So these kind of additional benefits, which are of no cost to you, may be in your plan. So let's talk about going into the hospital. I think a lot of people don't realize that going into the hospital and having to stay overnight or over a period of time to get treatment, we try to make your stay as comfortable as possible, but it is not a hotel. And no matter how great the room looks, it does not have the same service that you would be expecting as if you went into the Hilton. So, there are rules and regulations that you do have to follow when you are there because it can affect your care. And we do have to be on our best behavior when we're in the hospital. There is unfortunately no room for disobeying your provider. If you do not agree with what your provider is suggesting with regards to treatment, you can ask for a second opinion or you can ask to change providers, and that is well within your right. But it is pretty important that you do try to comply when you do agree to a specific treatment plan. So a lot of times we have patients who do not want blood draws or are scared of needles. Now, you're in the hospital and you are getting treatment for, let's say, pneumonia, and one of the things that we need to do is make sure that you're checking up on your labs, and certain labs tell us whether the infection is getting better or worse. Sometimes we're looking at side effects from the drug that we're giving you as well. So it is important that we do draw blood when you are in a hospital and getting acute treatment. Being scared of needle sticks is probably one of the most common things that I have seen. Actually, being scared of a needle stick is probably more on people's mind than dealing with post-surgical pain. I've seen more people cry from needle sticks or knowing that they would have needle sticks, or even get mad and irate because we have to get blood from them. Now, as a provider, I think one of the things that I try to do is minimize the amount of times that I'm going to get blood from you. And a lot of us try to do that, not only because it's comfortable, but also every time we get blood, it does cost you money. So we're trying to get blood only at times where we need to know what is going on with your body. So talking about some of the other things that you have responsibility in doing is making sure that you're leaving your valuables at home and bringing only necessary things that you need for your hospital stay. Sometimes when I know that a patient doesn't really realize what is going on is when they usually bring a carry-on bag. Let me tell you the truth about doing that. A lot of times, things get lost, whether it's lost in the sheets or lost from your room. And it is going to be very hard for you to recover those items if they get lost in a hospital room. So do us all a favor and make sure that you're keeping any valuables that you have at home, making sure your loved ones take anything of value back home. There's also a few common sense things that people don't realize. I think it's pretty important to say that you shouldn't be bringing in your cigarettes, your alcohol, or any kind of illicit drugs into the hospital. Number one, if you're going to do them, you're going to try to hide and do them. And there's been multiple times where we can tell you've been smoking in your room, no matter if you did it in the bathroom. We can tell. Another thing is, if you're going to use alcohol or drugs or somebody's going to bring in that stuff, we're going to know as well. There's been too many times that I've walked into a patient's room and noticed that he is high. And it is quite funny when you listen to it, but knowing that somebody's been using illicit drugs while being in the care of us, it can be devastating, especially when we've already done a procedure, or you're about to get a procedure done, or we're giving you a drug to treat what's going on. I had this one case where a patient came in and he was a known cocaine abuser and he had chest pain. Well, he was dealing with basically a mild heart attack because of the cocaine use. While he was under our care, one of his friends brought him some more cocaine and he did that. Eventually, that led to a full-on heart attack while he was in our care, and that did not end well for him. We have little or no control over what you bring into the hospital, and it's not like you go through metal detectors or we go through your bags when you're coming in or your friends or visitors are coming in to visit you. But it should be common sense that there was one thing that caused me to get into the hospital. It's probably best not to do that thing once again. Another thing which is also common sense, and it may seem a little funny to you, I know it was a little funny to me as well when it occurred, but it does occur quite a bit, and that is getting your freak on in the hospital. I don't think the hospital is probably the best place to do that, but what do I know? Let me remind you, please keep that out of the hospital as much as possible. I know you may miss your loved ones or significant others, but don't do that in the hospital. More than likely, somebody's going to walk in on you. Another common sense item which people forget is leave your handguns and your pocket knives and hunting knives and AR-15s at home. The hospital has no place for them, and we probably are not going to use any of those in your treatment. So many times I have noticed that people forget when they are concealed carry and they bring in a weapon, and that does not usually end well. Those of you who love to carry knives on your person, probably best to make sure that you keep that at home or give that to your loved one to take back into the car, because it gets into a big debacle with security. And the last thing we want is to worry about safety when we're here trying to treat you. So make sure that you have no weapons on you when you're coming into the hospital. So one more on the common sense, and a lot of these are common sense, but it is interesting to see how many people forget, and that is refrain from operating hospital equipment without education from the staff or supervision from the staff. There has been multiple occasions where the IV pump is beeping and people are trying to shut that off, and instead of using your call button, you try to find the silence button. We've had occurrences where people have either turned off the medication or have accidentally increased the rate of the medication, leading to side effects. The other thing that people get handsy with is monitors. You know, the monitors are there to keep an eye on some vital signs, which are pretty important, especially if you are sick enough to have a monitor attached to you. And those monitors are being actually remotely monitored by a nurse somewhere else. So when you go about touching the monitor or taking probes off or playing with the wires that are on your chest, number one, we may not catch what we're looking for. Number two, we may think something else is going on. So don't play with any of the machines that are in your room. So one thing which may not be common sense is infection control procedures, which may be enacted based on what you have going on or a history of what you had in the past. So please be compliant and have your visitors be compliant with what infection control procedures have been given to you and for your room. The last thing we want to do is spread disease from one patient to another patient. It is very important that your physicians and your providers and your nurses also follow that infection control procedure as well. We're probably going to have a talk on this on the podcast with an infection control specialist. The next topic is about pain control. There's been many times that I've walked into a patient's room and the first thing they complain about is the pain that they're experiencing. And now people can get pretty irate with pain. I know I do when I've been dealing with pain for a period of time, and it just gets annoying. And I understand pain, you understand pain. We want to know when you are in pain, and you don't have to wait for your provider to come to you to ask you how you're doing for you to tell us that you're having pain. We want you to pick up that call button and let us know that you're having pain. Let your nurses know that you're having pain. How bad is your pain? And don't say 10. If your pain is a 10, that is the most excruciating pain that you've ever felt in your life. And a lot of us don't get to experiencing pain levels of 10. Childbirth, maybe. Passing a kidney stone, maybe. Having abdominal surgery without anesthesia, I'll give you that one. The point I'm trying to make is let us know at your earliest time that you're having pain so we can keep a close eye on it and give you the medications when you need it in a timely manner. And probably the last thing that I'm going to talk about is your responsibility to fill out the survey when they call you or they mail you out a survey. And the reason why this is very important is because it helps everybody grade the care that you have been given. This is really important in hospital metrics as well. We keep an eye on how well the hospital is doing at controlling these things. And if we're not doing a good job, we need to know so we can make the changes possible to improve the care of you in the future and anybody else that be coming into the hospital. So if you don't speak up, we're not going to know. And let us know when we do a good job. I think that's probably important too, because we do like to celebrate the things that we're doing really well. And that's all I have with regards to patient responsibilities. I hope that this has helped you and you kind of realize the things that you need to keep in mind when you're getting treatment and what will help us as providers give you the best care and how to be the model patient. Thank you for listening to another episode of Give It To Me Straight Doc. I'm your host, Dr. Mehta, and feel free to email me or look us up on Facebook and send me your questions, because I'd really love to do a segment just on answering your questions and getting much needed information out there. So, thank you.